Chapter 8, Energy Balance and Body Composition, Part 4. Body weight and body fat correlate with disease risk as well as life expectancy. The correlation suggests a greater likelihood of developing chronic diseases and shortening life expectancies for those with higher BMI and waist circumference. Not all over or underweight people will get sick and die before their time, nor will all normal weight people live long and healthy life. There are different considerations that we must take into effect. Body weight and body fat distribution correlate with disease risk and life expectancies. However, it's important to remember that correlations are not causes. For the most part, people with BMIs between 18.5 and 24.9 have relatively fewer weight-related health risks. Risk increase as BMI falls below or rises above the range. Different factors that are associated with being underweight include fighting against wasting diseases such as cancer, HIV, menstrual irregularities and infertility, and osteoporosis and bone factors, and we'll discuss those later on towards the end of this part 4. BMI and mortality. Epidemiological data shows a J or a U-shaped relationship between body weights and mortality. People who are extremely underweight or extremely obese carry higher risks of early deaths than those who fall within the healthy or even slightly overweight range. Those mortality risks decline with age and shift with a person's state of health. For example, in cancer, a higher weight is associated with a higher survival advantage. Independently of BMI, factors such as smoking habits raise health risks, and fitness lowers them. A man with a BMI of 22 who smokes 2 packs of cigarettes a day is jeopardizing his health, whereas a woman with a BMI of 32 who walks briskly for an hour and a half a day is improving her health. Health risks of underweight. Fewer than 2% of U.S. adults are underweight. Some underweight people are active and healthy. Some may be underweight because of malnutrition, smoking, substance abuse, or other illnesses. Cancer may cause a person to become underweight and suffer from malnutrition. Underweight women may have menstrual irregularities and may become infertile. Women that are underweight may also have osteoporosis and bone fractures. Underweight people may benefit from weight gain. Risks associated with being overweight and obese. Obesity is designated as a disease, and it has health risks that include things like elevated blood sugar, elevated lipid levels, which are going to include your cholesterol, your HDL, your LDL, and your triglycerides, and we've talked about those previously when we discussed fats. More likely, people that are overweight or obese may be disabled in their earlier years or as they age due to knee, foot, ankle, and back problems. And of course, the medical cost for people that are overweight or obese are generally higher. There's also a loss of productivity because of their physical limitations, as well as premature deaths. And you are seeing some insurance companies also penalize people for being in the obese category. That is something that some insurance companies are charging an additional rate for people that may fall into a different BMI range or meet a different criteria according to the insurance standards. Also, with insurance, a lot of companies will charge a higher rate if you smoke as well. So this is something that we're going to see continue, I think, in that industry. Specific disease risks include cardiovascular disease, which is elevated blood cholesterol levels, and hypertension. And we'll discuss hypertension in a few slides. Central obesity, of course, is obesity around the midsection. And of course, you're going to decrease your risk of cardiovascular disease if you lose weight and get to a closer to normal weight. Diabetes type 2, which we've talked about, also is attributed and seen in people with central obesity and people with weight gains and elevated body weight. And this will have that blood glucose level fasting 126 or higher. Cancer, the time and degree of overweight and obesity is going to be a factor, but cancer, there are many, many different factors that play a role in that. Inflammation and metabolic syndrome. Chronic inflammation will cause weight gain, and of course the location of stored fat is going to make a significant difference in how those things are changing the function of the body. We have atopic fat that is listed here, and we'll discuss that later on. I'll give you some examples of that. And insulin resistance, of course, is when you have that abnormal glucose level where the body is resistant to insulin because of other factors, and the pancreas is not able to produce as well as it possibly wanted to. Gene expression, of course, varies from increased inflammation, and cluster of symptoms include other risk factors, including metabolic syndrome. This discusses the levels and the factors that play a role in metabolic syndrome: elevated fasting blood glucose, abnormal lipid levels, elevated blood pressure, and high blood pressure.